Hey everyone, this is Dr. Romas Buivydas of Airing Addiction coming to you from the New England Recovery Center here in Westborough, Massachusetts. Welcoming all of you viewers and welcoming our guest for this episode, Ron Burgess, who is the Family Engagement Specialist here at New England Recovery. Ron, welcome to the show.
Thanks for having me. Thanks for having me, Dr.
Very happy to hear you. I know you've been on the show when it was on radio. Now at least we're live and being taped right now.
Yes, sir.
So welcome. I'm looking forward to this.
Thank you.
Family engagement is a big thing that we started a few years ago.
Correct.
And now more and more places are taking this over. But we've really, I think, made it the best it can be to help families and our clients. So having said that, I'd like if you could explain to the folks watching, what is family engagement and addictions treatment, especially here at New England Recovery, the spectrum of Faris?
Well, family engagement is basically, engaging a family, because here, we're not technically big on only individual recovery, but also family recovery,
Okay.
So basically keeping in mind that it's important to engage with those families here within that first 48 hours of a client getting here.
So why within the first 48 hours?
Well, within the first 48 hours, because more so we want to capitalize on those emotions, those feelings, we want to capitalize on all the pain they've been through, and sometimes it can assist in minimizing those worries too. Also of, where is my loved one? Some families don't even know their loved ones are in treatment.
Yeah.
Here, when they get that call from the family engagement specialist, it's more of a,
Wow.
sense of thing.
Like a bit of a just, I got to know where you are, you're
Right.
here, you're okay.
Right.
Wow. Okay. So within 48 hours, that's a remarkable feat to do, actually.
Right.
Because I'm assuming, as we both know, that many times folks coming here have burned their bridges with family or in the process of burning the bridges,
Right. Yeah.
sometimes don't know where their families are.
Right. And that's common also. We have clients that may come in, after probably multiple episodes that, feel that bridge is no longer repairable even, but, that's where family engagement comes in, because here we believe that the likelihood of our clients here restoring those relationships with immediate family are more likely to be rebuilt, but at the same time, the family's in pain also,
And that's the thing. Addiction hits not only the individual, as we know, but it hits the loved ones, extended family, friends even.
Friends, recovery supports, and things. And it's a big picture, because although the family and the recovery supports aren't technically the ones engaging in those addictive behaviors, they're still being impacted negatively, whether it's emotionally and we can go a little bit more severe sometimes physically, and that's the main reasoning behind that addiction being a family disease, because it doesn't only impact the client, but it has an impact on the family also, so it's only the best somewhat care, to say, let's not only, assist our clients in maintaining their sobriety and work in the program, let's also find out how can we assist family and recovery supports of working their program, whether through Learn to Cope, Al-Anon, things of those sort.
Okay, so you're able to guide family members as well for extra help, for support.
Correct. And that's big because what's common is families don't know where to go. And they've tried multiple things. So when they encounter, a facility that has that family engagement component, they have someone they can go to who can guide them and assist them with being around other families and recovery supports.
Okay. So again, there's some mutual self-help even for families. I think that's a brilliant way of doing it. Can you walk us through what a typical episode encounter is for you?
Right. So in regards to clients, we commonly have clients come in and they're looking to make amends. So they have burnt those bridges. And like I stated previously, some of them feel that those bridges will never be repaired again. So with that being said, we like to say the first start is by engaging that family, and by engaging that family, that's somewhat sufficient, you know, for the family to understand that my loved one has some, you know, sufficient awareness that their addiction has had a negative impact on me, given their asking me to engage in their recovery and treatment while they're in programs.
Okay.
You know, and that's big.
Yeah,
you know, because some families say, wow, like, you know, we just got into an argument. I didn't know she wanted you to call me. I'm like, hey, she put you on that list that she wants to repair this. And she understands that it has had a negative impact on you also. You know, and that's big. And it's somewhat evidence-based, but it sends a good message, you know, to the families, you know, that my loved one is trying to not only work and prioritize their recovery, they're thinking about the bigger picture, family recovery, you know, because we're in this together, technically.
Right, so they've already, because when they were using under the influence, that whatever terminology you prefer to use, the family probably thought they didn't care, and maybe they didn't care about the family. But now they've gone through withdrawal management, getting stronger again.
Yes, sir.
And now they're saying, hey, I want my family back. Powerful.
And it's big, you know, and once these families come in, you know, and yes, it's amazing that that message has been sent that my loved one is really willing to engage me in their recovery and treatment. That's amazing, you know, and now it's time to let's assess this family in their recovery support knowledge of addiction as a disease. Because sometimes that lack of sufficient knowledge is what's hindering the family sometimes wanting to repair the bridge on their end too. Because my loved one is doing this by choice. You know, it's not a disease, Ronald. I've heard it's not a moral, it's a moral failing. They're making decisions and choices, you know, and it's important for family engagement for us to also educate those families through that process. You know, that this is not it's just like cancer. You know, this is a family, not only family, but brain disease also. You know, so educating them on that to help them understand that their loved one has a disease, you know, and their disease doesn't define them technically.
I think that's a great way of helping folks understand that it is a brain disease. We already know that. That's been established scientifically. But because of all the previous stigma attached to, as you said, moral failings and things like that, lack of willpower. But when you said folks who are battling cancer as a disease, hospitals have family rooms, have family meetings for the patients there as well. So why wouldn't you want to do that for the addiction treatment side as well?
You know, and it's common, you know, because through that family process, you know, I conduct what we call a family engagement screening.
So what is that?
And what a family engagement screening is within that first 48 hours, it happens over the phone. So the family engagement screening is assessing the family as a whole, but more so assessing the appropriateness of that family in the recovery support being allowed to engage right now. You know, and that's important, you know, because what happens in a lot of cases is, you know, whether we talk about enabling, we have families that may enable when they come in and take loved ones out of treatment. We have families that may be so emotionally drained and they let all those emotions out in an unhealthy way during a visitation. You know, so that family engagement screening is very important to assess everything, the family's knowledge of addiction, but more so, let's assess the appropriateness of this family engaging in their loved one's recovery and treatment today.
And what if they're using?
So that happens, you know, so there may be some times, because on that family engagement screening, one of the questions is, if you don't mind me asking, are you yourself in recovery? You know, and I may have, and it's somewhat common, you know, I may have that family member, dad or mom, that may state, yes, you know, I'm in recovery. You know, or sometimes I'm actually not doing okay.
All
right. But more so, they're stating they're in recovery, you know, and my next question is, if you don't mind me asking, how do you prioritize your recovery? Because this is amazing. You know, so, and what happens then is we may have families that say, well, you know, I'm going on a year and I don't do anything. I think I just got this and we're doing good. What message would I be sending, you know, if I prove that person to engage today without having a couple family sessions first, you know, with myself and a counselor. Because the message I will be sending, if I say, hey, that's okay, come on in, let's just do this. The message I'm sending that is, it's okay to not engage in anything to continue to maintain your sobriety. The message you're sending your loved one is that you don't have to do any AA or NA. Don't worry about the counseling. Don't worry about the therapist. I'm doing it. I got it. You know, and that contradicts the message we're giving our clients here. You know, we want you to leave with aftercare, treatment, a list of self-help AANA groups that you can attend. You know, that's beneficial. All in all, we want you to work the program, you know, and continue to work that program, you know, and the reasoning why that is so important because of studies, and studies show that individuals in recovery will always want the drugs or drink the rest of their lives, but without motivation to seek it. So summing it up, not that, you know, I'm doing this, and no, you're going to have triggers throughout your recovery, you know, not that you're motivated to use right now. It's more so because you're human, you know, so it's important to engage in some type of things, whether it's coping skills, whether it's substance use disorder counseling, family counseling, or even a sponsor in a lot of cases.
And I think what you just said is very important because a lot of clients of folks struggling with addiction, not knowing where to turn, feel that they aren't human anymore sometimes, or they've been degraded by other people or society, like those people kind of thing. And now at least you're trying to create more dignity, family reunification, maybe even sometimes.
And you know, and I always kind of add it and kind of put it on the same level as diabetes sometimes. You know, that person on that diet. You know, it's not like, hey, I'm on a diet, so I'm never going to think about sweets again. I'm okay. There are going to be some times where, you know, you're at a restaurant, KFC, that's easy. I'm not going to eat that mac and cheese to mess up my diet, but I'm at the family reunion right now. Grandma makes the best mac and cheese. Oh, it's going to be tough. You know, so you're going to encounter those things, you know, and those communist family is saying that if you're having urges, cravings, and triggers, you're not going hard enough then, you know, and I'm saying, no, that's not true. You know, it's because they're human, you know, and it's going to happen.
And you're helping the family buy into the recovery as well.
Right.
Okay. So that makes a whole lot of sense now, and I'm glad you're explaining it to folks, because otherwise they may simply think, oh, is it family therapy or something?
Oh, so and that's the biggest piece, and you know, we talk about that a lot, you know, because there's a big difference between the family therapy and engagement piece. You know, and family engagement is solely education, you know, education and guidance, you know, and like I said, I strongly feel that the number one way we can minimize this stigma revolving around addiction is by educating, you know, educating that this is not a choice, this is a disease.
So what kind of education do you provide for families? What kind of topics do you go over?
So I facilitate a family renewal program here.
Okay.
All right. And as a requirement for families to be approved to visit, they have to engage in that family renewal program at least once a month.
Okay.
We find that never happens. They keep coming.
So there's not resistance.
They just keep coming.
Wow.
You know, and I think that's amazing.
That is amazing.
You know, it's amazing when you have a loved one or a client who has left this program a year ago, and their mom and father still comes faithfully Saturdays, and they're no longer here.
Wow.
Because this is, Ronald, our, you know, family support group that we gravitate towards. You know, and there's other ones, Learn to Cope, Allies in Recovery, Naranon, Al-Anon. We can go NAMI route for mental health. There's so much recovery or family support groups out there. You know, and like we tell the families here, if you're okay with our family renewal program being your go-to family support group, we're open to it.
That's amazing. That's evolved. Wow. From what you've been doing, now people just want to come in just to be in a support group.
And it's amazing. You know, what better feeling to be around other individuals that's going through the same thing.
You don't feel alone.
You don't feel alone. And, you know, and that's the big thing. You know, a lot of families feel alone, and sometimes that trickle downs to, you know, where did I go wrong, right? You know, and sometimes I'm telling family, you may not play a big contributory factor to what's going on right now. You know, your environment was a safe and amazing environment. You raised your loved one the right way. You gave them good qualities, taught them good morals. But that's not the only environment your loved ones are in. You know, so it's helping the families understand that, one, they didn't cause it, they can't control it, and they definitely can't cure it. Those 3 C's that Al-Anon really engraves in families, you know, to help them understand that as family recovery supports, we don't have the solution to this, you know, and the best way we can support our loved ones is by getting to those family support meetings and educating ourselves about this disease.
So how many folks come to a typical family renewal?
A typical
session?
family renewal program is about 20 plus family members.
Wow,
20 plus.
So that's a
20 plus.
That's quite a bit.
Right. You know, and it's so amazing. It's amazing. They cry.
Mm-hmm.
They speak up. Sometimes I call it the breakthrough.
Mm-hmm.
You know, and I remember us having a family renewal program. We had a father there. You know, and father began to cry, and it was very distracting.
Mm-hmm.
You know, and he was loud.
Mm-hmm.
You know, as I facilitated, but he couldn't control it.
Mm-hmm.
You know, and it was a somewhat packed family renewal program that Saturday.
Mm-hmm.
You know, but it was loud. You know, so as I'm pacing, I'm facilitating. You know, his hand finally goes up because I can barely facilitate. That's how loud he's crying.
Okay.
You know, but I want to keep going.
Right.
You know, and give him. You know, but his hand goes up
Mm-hmm.
while he's crying.
Okay.
You know, and I call on him obviously, and he turns around to the other family recovery supports and he puts up one finger and says, basically, give me a minute. He has to get himself together. I'm talking, this guy can't even breathe. He's crying so much. Took him about 2 to 3 minutes to get himself together.
Mm-hmm.
We were silent for 2 to 3 minutes while he cried. And the only words that came out of his mouth was, I'm ready to talk about it. You know,
That's powerful.
And that was it, because he has friends that don't look at people with substance use disorders in a positive way,
Mm-hmm.
that are very judgmental.
Mm-hmm.
But his whole thing is, I can't let them know that.
Right.
I have a daughter in recovery,
Mm-hmm.
because then they may question how much of a good father I was, and I may have not raised my daughter the right way.
Mm-hmm.
You know, and it's basically helping that type of family member understand that you raised your daughter the right way. You know,
But it also speaks, if I can for
Yeah.
a second, it speaks to you making that program, that session,
right,
feel safe enough
Right.
for that man
Right.
to cry.
right,
Because if he didn't feel safe enough, I'm not going
Right.
to share anything, he
Right.
would probably have shown anything.
right. And that's what it's all about. And even when we talk about our clients, you know, we want them to go to those meetings, those self-help AA, NA meetings. Even when we talk about psychiatry and therapists, we want someone that you feel safe around,
Mm-hmm.
someone that you can build that rapport with, you know?
So let me ask you this. Have you ever had folks attend that just heard about it and came in?
Yes. Now, the way that works is, because we're very big on confidentiality,
Right.
you know, so the way that works is there's sometimes where we may have individuals in other programs that are within our campus,
Okay.
you know, and what the counselors have done is they will reach out,
Mm-hmm.
and we may have a client at the CSS level of care, and I may have a counselor reach out and say, hey, I think this family will do very good or benefit from engaging in your family renewal program. Ron, can you inform me of what's the topic of discussion for this Saturday?
Okay, so at least you're informed.
Right.
They're within Spectrum's
Right.
treatment facility. What if someone says, hi, I'm from way out there.
Uh-huh.
I'm not my kid is not in treatment, but can I attend? Is that allowed?
So it's allowed, but it's case by case.
Okay.
You know, because the biggest thing is, like I was saying, we're big on confidentiality.
Sure.
But say, for instance, I can't accommodate it at that time.
Right.
It's like a no wrong door policy. You know, I'm going to ensure that I give you the information.
Mm-hmm.
I'm going to connect you with the right people. You know, instead of saying I can't help you, this is not the place right now, or
Right.
whatever the case may be.
Right.
You know, because it's still important to connect that person,
Right.
you know, with someone. The overall goal is to, and this is the overall goal, is to open this up to the public one day. Yeah,
I think that would be great if that can be done.
Right.
Because if it's happening already by case by case,
Right.
and the reason I'm saying is because our viewers,
Uh-huh.
I'm sure they're going to say, hey,
Right.
can we come to
Right.
this?
Right.
And so I just want to make sure that how does that work?
Right. And you know, and that family renewal program has come a long way.
Mm-hmm.
You know, and once it has gotten to the point where really wanted,
Mm-hmm.
you know, and because I think it's an amazing family support group.
I agree.
You know, so we're in the process of building a door, hopefully, and all this stuff. I can't wait.
Hey, I love the title alone, Family Renewal.
Right. Yes.
To renew a
yes.
family.
Oh, I love that
it.
title.
Oh, see, and you show the enthusiasm.
Right. Yeah, I love it.
That's infectious, I think,
Right.
folks. So while we're on this kind of thing, have you had, and I get, and folks know that I always want to hear this, you know, what's the background to
Right.
something. I'd like to hear what was